To reframe pretty much everything you thought you knew about that stubborn winter cold. You know the one, right? The endless box of tissues that basically becomes your roommate from January straight through to March. We usually just brush it off as another seasonal bug. But what if the data is telling us a completely different story? Today, we're unpacking the actual medical science behind the winter sniffles. We'll look at some really fascinating clinical studies and surveys to see what is literally going on inside your airways.
So I want you to ask yourself, is it really a winter cold, or is it something else entirely? If you've been battling the exact same congestion for weeks on end, but you don't have a fever, and you're just feeling completely drained, well, we need to consider if your endless winter sniffles are actually a year-round condition, one that you might be accidentally mismanaging. To figure this out, we have to bust a massive misconception. Section 1. The winter allergy myth. Because most of us think of allergies as strictly a spring or summer problem, blooming flowers, cut grass. But respiratory allergies, they absolutely do not take a winter vacation.
If you want to evaluate your own symptoms, here's a quick breakdown. A viral infection almost always brings a fever, muscle aches, and crucially, it clears up in under 10 days. But an allergic reaction, specifically allergic rhinitis, gives you those crazy fits of sneezing, absolutely zero fever, and it stubbornly hangs around for more than 10 days. If you've crossed that 10-day mark, you're probably not fighting a virus anymore, you're reacting to an allergen. And this is a huge deal, because as respiratory specialists like to say, it's one airway, one disease. Meaning, if you have asthma, an unmanaged winter allergy can seriously wreck your asthma control, because that inflammation just travels right down your respiratory tract.
And this timeline shows exactly why winter allergies hit so hard. It's basically a perfect storm. In a lot of climates, early tree pollen, like hazel, actually starts blowing around in January, and then alder kicks in by February. At the exact same time, because it's freezing outside, what do? We crank up the heat and seal all the windows shut. This creates this intense, closed-loop indoor exposure to things like dust mites and indoor mold. So you're getting hit from the outside and the inside, all while sitting there thinking you just caught a bug. Now that we know it's an allergy, let's look at the hidden impact. Section 2. The sleep disruption link. We're talking about a surprising physiological toll that goes way beyond just needing to blow your nose. It is actively attacking your sleep. Just consider this shocking figure, 68.3%. According to a 2024 clinical study published in the Journal of Otolaryngology and Rhinology Research by Dr. Rachel Davis and Dr. Ethan Wilson, a massive 68.3% of adult patients diagnosed with allergic rhinitis suffer from sleep disturbances. Think about that. More than 2/3 of the people dealing with these allergies are having their nightly rest actively hijacked by their condition. And the researchers didn't just ask if people felt tired, they pinpointed exactly what was happening clinically. And the worse the allergy, the worse these specific sleep disorders get. Patients experience prolonged sleep latency, which is a fancy way of saying they're just lying awake for ages trying to drift off. They also suffer from frequent nocturnal awakenings. As a direct result, they're dealing with excessive daytime sleepiness and a severely impaired overall sleep quality. So you aren't just exhausted because your body's fighting an allergy, you're exhausted because the allergy is literally stealing your sleep.
The absolute most crucial takeaway from the study is this. Nasal congestion is the strongest predictor of sleep disruption in these patients. It's actually not the sneezing that keeps you awake or the itchy eyes, it's the physical blockage of your airway. When your nasal mucosa gets inflamed and congested, your brain senses a drop in airflow. That completely fragments your sleep architecture, forcing you to micro-awaken all night long just so you can breathe.
Pretty wild, right?
Because this congestion causes such a massive hit to your quality of life, we have to look at how doctors actually quantify it. Section 3. Measuring the misery. Let's look at how the medical community objectively maps the distress inside your nose.
What's super interesting here is the actual science of measuring that misery. Enter the Lund-Mackey score. Instead of a doctor just asking, hey, how bad is it? This is an internationally recognized staging system. It uses CT imaging and endoscopic evaluation to objectively grade the severity and the physical spread of chronic rhinosinusitis. Doctors literally score the blockage in your different sinus cavities to build a standardized map of your inflammation. And we have this system thanks to the pioneering work of a legendary British surgeon, Dame Valerie Lund.
Dame Valerie Lund is, without a doubt, an absolute titan in the field of rhinology. She's an emeritus professor at University College London and has spent decades developing the very endoscopic sinus surgeries that are used to treat these severe conditions today. Her contributions are so landmark, so totally foundational to modern ear, nose, and throat medicine that she was actually elevated to Dame Commander of the Order of the British Empire in the 2024 New Year Honors. Her work guarantees that when congestion turns into a chronic, life-altering disease, surgeons have the exact tools and staging systems they need to go in and fix it.
But, before patients ever see a surgeon or get a Lund-Mackay score, they usually try to fix the problem themselves. Which brings us to Section 4, the nasal spray paradox. We're going to look at a fascinating cross-sectional survey from Saudi Arabia, published in Frontiers in Pharmacology, that really exposes the desperate things patients do just to breathe.
This data reveals what is perfectly termed the nasal spray paradox. Researchers surveyed over 400 adults about how they use over-the-counter xylometazoline nasal decongestant sprays, those fast-acting ones you can just grab at any pharmacy. Well, over half the population, 51.4%, had good knowledge about the drug's rules and risks. 55% had a positive, responsible attitude toward it. But look at that third bar. A shocking 8.8% actually practiced safe usage. Meanwhile, over 44% reported actively poor, unsafe practices. It turns out people know the rules, but out of sheer desperation to just get some sleep and breathe, they break them anyway.
And breaking the rules with these specific sprays leads directly to a condition called rhinitis medicamentosa. When you use topical decongestants, they rapidly shrink the blood vessels in your nose. Relief is instant. But if you use them for too long, your receptors get completely exhausted. You get diminished vasoconstriction, and as the drug wears off, your blood vessels dilate massively. This causes a rebound congestion that is actually way worse than your original allergy. You then need more of the spray just to breathe, which traps you in this vicious chemical cycle of dependency. You are literally causing the exact congestion you're trying to cure.
To avoid this trap, you absolutely have to memorize this time frame: 3 to 5 days. That is the absolute maximum recommended duration for using an over-the-counter topical nasal decongestant spray. Use it for a couple of days to get through the absolute worst of it, sure, but after day 5, you really have to stop. Otherwise, you risk triggering that severe rebound congestion and turning your winter sniffles into a permanent year-round nightmare.
So, how do we actually fix this? Section 5, closing the practice gap. We really need to bridge this massive divide between knowing the medical risks and actually practicing safe habits when we treat our winter allergies.
The researchers in that Saudi Arabian study didn't just look at the problem. They looked at who was actually using the spray safely, and the data shows some really specific predictors of safe usage. Female patients, individuals with higher educational attainment, and, interestingly enough, people with a history of severe chronic nasal infections were much more likely to practice safe habits. Probably because they've learned the hard way just how bad it can get. But the absolute strongest, most actionable predictor of safe use? Pharmacist-led counseling. Actually getting proper advice from a medical professional, rather than just blindly grabbing a box off the pharmacy shelf.
So, to put all this into practice, here are the steps you can take today to empower yourself. First, evaluate your symptoms. If it's dragging on over 10 days with zero fever, treat it like an allergy, not a cold. Second, monitor your sleep. If it's taking you forever to fall asleep and your sleep quality is tanking, your airways are probably physically blocked. Third, if you do reach for a fast-acting decongestant spray, strictly limit it to under 5 days to avoid that terrible rebound dependency. And fourth, talk to your pharmacist or doctor. There are incredibly safe long-term alternatives out there, like corticosteroid sprays or antihistamines that actually treat the underlying allergy without trapping you in a rebound cycle.
So I'll leave you with this final thought. Are your winter sniffles truly just a cold, or is it actually a poorly managed allergy? It might be time to rethink those lingering symptoms, rethink your sleep hygiene, and absolutely rethink your medicine cabinet habits. Armed with this data, you really don't have to suffer through the winter. Thank you so much for joining me for this explainer, and hey, here's to finally taking a deep, clear breath.